Thanks for joining us on the Bite of Dental Marketing. I have Ian with me. Ian, thanks for joining us.
Hello, hello.
So
Nice to be back. It's lovely to be back.
it's great to have you. So my question today is we've been in dental marketing now for a while. What is the most oversold and undersold topic in dental marketing?
Ooh, so let's first tackle the most oversold.
Most over. All right,
And
you go and then I'll go. All right.
okay, so for me, I would say one of the things we hear so much about that it's such a hot topic, and dentists are always asking about this in dental marketing, and it definitely costs a lot of money. Paid media ads,
Mm,
Google ads.
Google
They,
Ads, most oversold.
there's
All
this
right.
idea of if you're gonna run me ads, man, I'm gonna be so busy. I'm not gonna know what I can do
Mm.
with what I'm gonna do with myself.
You
And
know,
we
it's
hear that all the time.
it's interesting you say that. Your oversold ties into my undersold. So
Okay,
your oversold is Google Ads. My undersold is the theory that dental marketing is so simple that you can turn on one channel and just have it work.
mm-hmm, mm-hmm,
So I think your oversold Google Ads is my a version of my undersold of I think we live in a complex world,
mm-hmm.
and I would agree with your Google Ads one in that there are people out there that sell it as it's the answer, but a lot of the calls we hear that are seven, eight, up to $17, $20 clicks are not great patients. And we live in a world where I think people do their research. I think they read the reviews. I think they go to the website. I
It's
think
a
they look
journey.
at social
It's
media.
a
It's a
journey.
journey, and
Yeah,
everyone's
yeah,
journey is very different. Yeah. But no, Google Ads, that's a good one. Hmm.
yeah. And if you think about it, there's just we've also seen a bit of, I wouldn't say distrust of the pandemic. So what happened during the pandemic was people, I think, became a lot more tech smart. They were at
Hmm.
home a lot. They had to navigate
I
online
would
in
agree.
ways they did not have to do it before.
Hmm.
And that came with a learning curve of, okay, well, maybe before I would just search something, see the ad, and just click on the first result I see. But more and more, you're seeing people becoming street smart, if we can call it that, and they're scrolling past those ads and then going to the organic results because they trust it more.
Right.
And that's why often you would think the paid media or the Google ads being sitting at the top, okay, that's my one-way ticket to people seeing me and me getting new patients. And one thing where I do see that it does play a big role is for brand recognition. If you want to make
Hmm.
sure that, especially for startups, if you want to start seeing as if somebody wants to make sure that their practice's name starts to pop up in a local area, new guy in town, new girl in town, of course, by all means, branded ads, run them out there. But just throwing out the dentist near me or the
Yeah.
specific service and hoping it's going to land is definitely not the ultimate success story, and that's why it's my choice for the definitely being oversold in marketing as a whole, not just in dental marketing.
No, I would agree. I think in 2014, 2015, when we really kicked off the company in earnest, and I think that Google Ads was our most viable channel of patient acquisition.
Oh
I
wow.
think that, yeah, I think that you could turn on Google Ads and see an immediate pop in new patient phone calls, not just phone calls. And I think we've seen over the last few years that while Google Ads is still a viable strategy, I think
Mm-hmm.
now it's part of a broader strategy of, I mean, in marketing, we would call it like multi-channel attribution, right? Or multi-channel touch
Mm-hmm.
points. But I mean, a dentist doesn't. I mean, we would call it journeys or something else. But I think it has to do with if someone's looking for veneers, I think they're going to Google veneers and look for specific questions around, veneers in a 48-year-old that
Mm-hmm.
has, this and,
Mm-hmm.
implants for diabetics and implants for veterans. I think there's some group of the population now that I think long tail keywords have become very, very prevalent in searching
Hmm. As people are more sure about exactly what they want
as
to
people are more
search and what
sure.
they want.
Right.
Yeah. Yeah.
Agreed. And then I think the dentist near me, dentist in my area type searches where I just want a dentist.
Hmm.
I think those tend to be more brand recognition now. And yeah, I think it's lowered some of the effectiveness of Google Ads as a standalone channel. I think it needs to be
Hmm.
part of the strategy. But yeah, I agree.
Hmm.
It's oversold. There are companies out there that just sell Google Ads, and they're going to promise you 40 new patients a month.
Hmm.
And, yeah, yeah,
No,
interesting. Now,
that's exactly. I do want to hear what you said that ties into your what is undersold.
well,
Um,
yeah,
can you elaborate on that some more?
for me, the most undersold thing is how simple it is. If you just do social media, you just need to post every day. You just need to do social media.
Hmm.
You just need to do postcards. You just need to turn on Google Ads. You just need to turn on whatever they're selling.
I'm always
Um,
wary of you just need to do this. I always
oh yeah, yeah,
that's
yeah.
when I start to get worried.
It reminds me of anytime my two kids have gotten to the age where they start fighting, and I tell them anytime you're just telling someone something, it is probably not a good thing. Yeah. Um, no, it's true. I find that people want to oversimplify how easy the thing is they're selling. And I think that we live, a marketer would call it a multi channel attribution world. I
Hmm.
think that the days of, short of a very intimate relationship, a wife, a close family member telling you to call this dentist and make an
Hmm.
appointment, I think everyone's going to look at reviews. I think we're going to sort by the negative ones and decide if they apply to us. I think we're going to hit the website. I think most younger people, and I'm just calling young under 45 or 50, are
Hmm.
probably going to hit
Hmm.
some form of social media
Hmm.
to see what their page looks like. Um, I think you're gonna, and I think all of those are going to weigh into your decision, because I think unless it's a family member, I don't think you're getting one or two recommendations for a dentist. I think that if
Hmm.
you're looking for a dentist, you're probably asking multiple people, and you're probably getting two or three recommendations.
Hmm.
So this idea that someone referred me to someone and I'm just going to blindly call and make an appointment is, I think, oversimplistic of what really happens in the world.
And that's as
And
the consumer has become smarter. That's
consumers
just
become
a thing.
smarter. Yeah.
That's
And
just reality that any dental practice needs to understand. The consumer has become smarter and smarter as the
agreed.
digital age has. You have younger generations, as you just mentioned, coming in, understanding the digital age, understanding how to navigate these platforms, understanding what are some of the warning signs to look out for, what are some of the positives to look out for before they make that informed decision, not just for dental services, but any type of medical procedure or any type of service or product that you're looking for. There's now various steps in
Hmm.
place. And that's where that multifaceted journey you just spoke about comes into play, and where making sure all of the right things are in place, in addition to Google Ads, Google My Business, the right website, the right social media, the right
The
pictures on the
branding,
website.
yep,
Exactly. And that comes
yep.
together to help that potential patient make that final decision.
Yeah, I think one of the most improved channels we've seen is patient validation, so patient testimonials,
Hmm.
and more case study type videos of doctors talking about treatments. And I think
Hmm.
it's helps them make that connection, which we've seen very effective. But so you mentioned you're over. Talk to me about your most undersold in dental marketing.
So for me, that's a pretty easy one. It's how involved the dentist is in the marketing efforts of the practice. You can't, in my opinion, have a very successful marketing of a practice if you don't have the dentist involved, because there's a
Hmm.
detachment of the number one uh, the number one player in this entire game. The thing that you need to be
The
doing is
dentist is
getting
the
patient.
product.
That is the product. that is
Keep the
the number
product.
one player. And if that number one player in this equation is not willing to be involved in the efforts to market them and to market the practice and make it a success, it's kind of like a ship without a captain at the helm, expressing the directions that they would like to go and what they're passionate about, what they want to feel. Because a marketing company can only be as successful in marketing the practice and the brand and getting exactly to the potential patient what the dentist wants if the dentist is actually involved in guiding that
Now,
journey.
what does involve mean to you? Like, is it attending the weekly or monthly meetings? Is it what does involve mean to you?
Great question, because I'm sure there's some dentists listening to this now and saying, "Well, I have a marketing agency. Why do I pay them then?
Yeah,
Why must
well,
I do it?"
that is the thing we hear. If I hire you guys to go to get my patients. Yeah.
So, how I would explain that is to go back to the captain of the ship and just being at the helm of directing. You don't need to be down in the barracks. You don't need to be shoveling coal into the fight. That's why the marketing agency is there. But if the captain does not give a direction of these are the services important to me, this is how I treat patients, this is what I want to do, and this is how I see my practice in this many years or what I want to achieve, then marketing agencies can start to take that information and start to create magic, which they're so good with, or what we're so good with. But to just essentially sit back and say, do something, create success, makes it very, very difficult, especially when there's lack of communication between what success means.
Yeah, yeah, agreed. Hmm. Yeah, I think my most let's see, we flipped them. So I went over and or under, and you went over, and now you're under. I have my over. I think interesting enough that also ties in your dentist involved. I think that my most oversold is I can get you X type of patient.
Mm-hmm.
I can get you a veneer patients. Just turn on. I just want veneer patients.
Mm-hmm.
Well, man, how many prepless veneers have you done in the last year? Two? Okay, you don't have the demonstration of excellence. Like you don't have. There's not this body of work out there that I can go market. What CE have you done on the topic? You know,
Mm-hmm. Mm-hmm.
you just want it because that's the most profitable, and that doesn't mean I can deliver that patient. I think that you have to. I think it is oversold that I can deliver all on fours, that I can deliver full mouth reconstructions, that I can deliver sleep apnea patients, prepless veneers. You know, all these other like really high income,
But it's not
high
something
revenue.
that the dentist is actively engaged in to build
Right.
out. Yeah, yeah.
And you know, I think it's oversold in, again, we've talked about that journey. I think it's oversold in how I think there's a, most of the people looking for a dentist are new to the area, they've changed jobs or whatever, and they're looking for a dentist.
Mm-hmm.
They don't have a specific point of need. They're just looking to establish a base of this is my family's dentist. I think
Mm-hmm.
that is
If
the
I need
bulk of
somebody, where
people
do I
looking.
go? Yeah,
Yeah.
yeah.
I think, you know, somewhere between 20 and 40% of the population have a point of need.
Mm-hmm.
So I'm unhappy with my front six. I want new crowns, or I know that I want Invisalign. I know that I want an implant. I think those patients come in a very educated manner because I think they're coming in with the treatment in mind,
Mm-hmm.
but they're not looking for just any dentist that happens to have a great website. They're looking for experience and, you know, a very polished approach to what they're looking for. And then they're looking to make the connection. I
Mm-hmm.
think they're still looking to make a connection, but I think they're looking for that expertise first.
Of course,
And I
of
think that
course.
that demonstration of expertise is very, very difficult because I think how many dentists have we talked to that said they're not amazing? I mean, you know,
Mm-hmm.
literally zero. And all of them, you know, I think you have to be a little bit arrogant to be in the game. But I also think that anyone who promises that I can get you X type of patient, I don't think they, unless you are already getting them, I think that's a really, really difficult job.
Mm-hmm. No, I
Yeah.
completely agree. And also what that if you do want to then build up into a direction where you want to do more of your all on fours or all on six and those big production procedures, then I feel it's important for dentists also to understand that there's a starting point, and you
Sure.
build toward. It's not just I only want all on four, all on six, or implant, or my high production services needs to be at the top of the list, and that's what I want patients for. Communicating with your marketing agency and saying, this is something that is important to me and that I want to grow in, and then to understand that it's going to take a couple of months for it to even start gaining traction, whether that's
Agreed.
with ads, SEO, on social media. You need to build that expertise that you just said, so that whether it's with search intent, that over time building up your online expertise on a certain type of treatment, ranking better for it, or just somebody seeing ads again and again for a specific treatment, to eventually say, okay, goodness, grape juice. I've seen Dr. Eric Hubbard a couple of times now for implants. He must be the top guy in the
Right.
Dallas area to go and see. And
Agreed.
understand that it takes time.
I would even say if you're not capable of performing the treatment on your existing patient base 4 to 6 times a month, be it prepples, veneers, be it implants, be it apnea, whatever, I don't think you should be marketing external for it, because I think that means you have some internal problem that you are not conducting yourself as the expert in that treatment.
Yeah, you
You know,
might want to do it, but it doesn't mean you're the expert in the area. And
it, or you know how to
if people
sell it,
know it,
or you
yeah,
know how to talk about it. And either way, marketing is going to go bad if you're doing it. Yeah.
I agree.
Well, Ian, this was awesome. Thanks so much for the chat. And this was your Bite of Dental Marketing for the day.
Thank you so much for having me, Eric. It's always a pleasure.